Good morning, everyone. Sarah Henderson. For those of you who are online, I am sorry to announce that we could not have Marie O'Neill speaking with us today. She just couldn't make her trip to Vancouver as she has intended, but I am very, very happy to announce that 3 of my colleagues from the B.C. Centre for Disease Control have quickly stepped up to the plate to give us a presentation on a very topical issue, which is this beef recall from XL Foods. And I'm just going to give you a little bit of information on these 3 folks. Sion Shyng has been working with the BC CDC for nearly 10 years as a food safety specialist and a dairy processing specialist. Cy previously worked in a variety of food industries as a quality assurance manager for more than 10 years, and with this experience is responsible for corporate food safety plan assessments in BC. He chairs several committees, including Market Safe, and teaches dairy worker course at BCIT. Maria Peters has over 26 years of experience as a meat inspector and supervisor. She's currently the meat inspection specialist at the BC CDC since September of 2011, and previously worked with Agriculture Canada and the Canadian Food Inspection Agency. Her experience encompasses all areas of the meat inspection system for multiple species from slaughter to ready-to-eat meat. And Lorraine McIntyre has been working at the BC CDC for over 16 years, first as a microbiologist in water, food, and outbreak diagnostic laboratories, and since 2005 as a food safety specialist. Lorraine is actively involved in research and specializes in food safety training, fish, and shellfish areas. She has a strong interest in education, having worked at Vancouver Community College for over 10 years, and is an active volunteer with the BC Food Protection Association. So a warm welcome to my 3 colleagues. And I believe that Lorraine is going to start us off.
I am. Thanks, Sarah. Thank you for that nice introduction. So today we're going to talk about an extremely large foods recall and resulting E.coli O157 outbreak in Canada. And I'm really pleased that Cy and Maria are also going to co-present. So we'll be trading off, and there may be some time delays. So just a quick agenda. I'm going to start off by talking about how recalls work, and then we're going to get into the recall itself, E. coli in raw meat, and Cy is going to present on the guidelines around that, specifically the Health Canada Guideline number 10. He's going to present the timeline for this XL food recall, and then Maria is going to talk about what went wrong, or what we think went wrong, and show some interesting slaughter videos. Then I'm going to take back the microphone and talk a little bit about the problems with case identification and tracing sources of illness to different kinds of foods. And then we're going to wrap up and talk about the issues at slaughter, at retail, and public risk communication messages. So at the top, I have some pictures of raw ground beef, which we've had a lot of recalls about, but also whole cuts of beef, which made this recall very interesting. And what I'm not going to talk about is E. coli. You guys all know what E. coli is. E. coli O157H7 is verotoxigenic. There's different kinds of E. coli that can cause different kinds of disease syndromes, but for the purpose of this talk, I thought this was a cute slide that we found on the net. We really only needed to know that these are poo bacteria and they cause disease, so we're not going to talk about that. Recently, we updated our provincial recall manual, so I just copied and pasted some things out of our manual. In terms of who is responsible for provincial food recalls in BC, it's ourselves and the regional health authorities and Ministry of Health, but in fact, the Canadian Food Inspection Agency does probably 99.9% of all the recalls in the province and across Canada. And they have responsibility under the Food and Drugs Act. And we correspond quite closely with the food recall coordinator here in BC, Eliza Yu, and we work together quite a lot. So at the BC Centre for Disease Control under the Food Safety Act, we have delegated authority for 2 positions. One is the Director of Food Protection Services, where we all work. And in fact, when Maria came on board, they gave her special recall authority, and her name is actually on the document, so that's why I have her name included here. But in fact, if a product needed to be recalled within a regional area of the province, the health authority itself could in fact issue a recall for that product as well under the Food Safety Act, and that comes under the purview of the Chief Medical Officer, and then province-wide, it's the Provincial Medical Health Officer. So just a bit of regulatory stuff. So CFIA, as I mentioned earlier, does most of the recalls, and these are separated into what they call Class 1 or high risk, Class 2 moderate risk, and Class 3, which is low risk. And I put some photos in there of some of these recalls. So obviously the recall that we're going to talk about today, XL, is a Class 1 recall issue. It's high risk. Eating or drinking this product could lead to serious health problems or death, and if it's in the consumer's home, there's often a public warning. This second one, Class 2 recalls, moderate risk. In fact, I rechecked the website, and this one is actually a Class 1, but it didn't go public. So this was for E. coli O157H7 in ground beef, but it was only sold to Burger Kings. And so the CFI doesn't make public announcements about all the recalls, although they are on their website. So this is called for this particular one here, it's called a HRI recall, so hotel, restaurant, or institution. Anyways, if you wanted to know, recent Class 2 recalls have been for salmonella in spices and things like that. And then the Class 3, I think this one did hit the news actually. This one occurred on October 7th. So the brown sugar and original frosted mini wheats got recalled for metal fragment contamination. So that was a Class 3, but they consider this a low or no risk. So in terms of how we operate with CFIA, I thought I would put this up because this is what happened with XL Foods. The CFIA does their risk assessment to determine if a recall is required, and actually they have a bunker in Ottawa. You know, they have a recall center. It's quite a important part of the work that they do, where they do all these risk assessments. And rarely, when recalls get really big, they need our provincial assistance. And that was the case for this recall, and actually 2 others that occurred this year. But that's when these high-risk products are actually in high-risk facilities like hospitals and long-term care facilities, daycares, maybe even the university. So in those cases, it makes it a lot easier if environmental health officers in the regional health authorities can come and help and do what they call verification checks. So what happens for high-risk facilities is that an EHO should physically visit that facility and make sure that none of these products are still in the cupboard or the freezer or the refrigerator. So what we do, our role is to screen the information that CFI sends us, make sure it goes to the right health authority, and then when we get the summaries back from the EHOs, we tabulate them all. So that's just a quick overview. Our procedures internally are just for recalls within the province. I thought that this diagram was interesting to show you because a lot of people aren't aware of the recall depth. So right now with this Class 1 recall that we're having, it's all the way to the consumer, but I mentioned earlier sometimes there's hotel, restaurant, institution. So in those cases, the recall might just be to the retail. So it could just be to the distributor of the product or the retail level. That could be a grocery store. But if the product hasn't been on the shelves yet and isn't in the consumer's home yet, then often there isn't a public message. And then, of course, there's the processor where they actually manufacture the product. So the recall manual that we have, it tells us how we coordinate our effectiveness checks with CFIA. And next week, I'm actually going to cover this in more detail. It also advises us on when we should issue a public health advisory. And here's just an overview of our process. So internally, if we get what we call a health risk event, it could either be a consumer complaint, it could be an inspection finding or a poor lab result, then we have to decide based on the severity of this health risk event what we should do next. And basically we do our own risk assessment. And again, instead of Class 1, Class 2, Class 3, we call it low, medium, and high priority. And I'm going to talk about this more next week as well. But I just wanted to show you how we approach it. So we we actually do have a plan and a method, which is good. So this picture here is just, again, to show that this particular recall of ground beef did cause illnesses. The first one in BC was the Vancouver Island man. And again, it included not only ground beef, but whole cuts of beef. And at this point, I'm going to hand it off to Cy, and he's going to talk about the guidelines for E. coli and ground beef cuts of meat.
Thanks, Lorraine. So in any type of food safety event, there's kind of two HAPs that we want to keep in mind. There's the food recall, and that's really identifying affected lots and removing that effectively from the marketplace. There's also the question, are there any illnesses associated with this recall? And if there are, that's where the public health agencies come on board, working with the food safety side, trying to eliminate, identify the sources, identify clusters, and work on the outcome on that. So in this case with the XL Foods, it started off pretty much as a standard food recall. And as Lorraine mentioned, this was our second large ground beef related recall this year. So why do we have recalls? Well, there's actually a document that Health Canada has had in place for many years, actually many decades. So it looks at what happens if you find generic E. coli or pathogenic E. coli in ground beef. So obviously if there's sampling and there's nothing found, there's no pathogenic, really, and there's no action required. That's hopefully business as normal. But what happens if you find above a threshold of 100 CFU, colony forming unit grams, in the sampling lot? Well, if there's no pathogenic and there's greater than 100 CFUs, well, there's no really action because generic E. coli is an indicator organism. It's not necessarily a public health problem. But you do want to look at the food processing environment and look at procedures. Is something happening there? Are there problems with sanitation? Is something being missed? Is something not being followed? So there is a follow-up action at the food processing facility. This is where we're at in terms of XL Foods. Whether or not we have a certain threshold level of generic E. coli, we certainly have the presence of pathogenic E. coli. And there's automatic triggers for consideration for a recall notice. So depending on generic E. coli, what level, there's a recall to retail, which is to the stores, or if it's gone beyond that, to the consumer level, so a public advisory, such as what happened here. And likewise, in the processing environment, if we know that we've detected it in the raw beef trim or the carcasses, and we've made ground beef products from it, or we found it in the processing environment on equipment surfaces, well, there's a risk there. So there's also recall action considered. Important thing to note is we talked about cattle and slaughter and all that stuff, and E. coli. E. coli is a poop bacteria, right? It's in there, and the goal for food processors is to keep it out of the product. So we shouldn't find it in the finished product. Okay, so how big is this recall? What do we know about the beef industry? I didn't put it up here, but the motto in the industry is go big or get out. And for economies of scales, for these national food processors, that's really what happens. And so if there is a problem, it tends to be a big problem because it's magnified. Looking at this particular plant, Lakeside plant, it's the second largest in Canada. It processes 40% of the beef products in Canada. So when there was a problem hitting the chain stores, we felt it right across the country. Over 2,200 employees, over 2 production shifts, 46 CFI inspectors. So there's a lot of people working in that facility. So if one person makes a mistake or there's a systematic error, it certainly is a big problem. And looking at global distribution, across Canada, 41 states, and into the international market. So as you can see, this can be a big problem. All right, looking at the timeline now, I've kind of looking at the data, I've broken up the timeline to sort of 3 different sections. The first one is looking at the detection. And then we bring in the illness component, and then now it becomes an outbreak investigation. So here's the first one. Where did we get the triggers? When did we actually determined that there could be a problem. Well, unfortunately, and it's kind of perhaps embarrassing sometimes, it was actually a shipment that went down to the States. So all shipments of beef going across the border, it's detained, it's sampled by the U.S. U.S. Department of Agriculture's Food Safety and Inspection Service, and they actually found a positive in a shipment of beef trim. So obviously it's detained and subsequently destroyed, and that information was relayed to CFIA because this is now a trade issue. The next day, CFIA actually found positive E. coli at the plant, and another shipment at the border was picked up as being positive. So now we have these two signals. Is there a recall? Well, based on distribution, that lot was there. Nothing got into the marketplace. It sounds like it's okay, it's contained. There is no need for a public recall. Are they related? Well, those are the questions that are being asked. And at the plant, CFIA is asking, well, we need some more information from the food processors. Let's look at distribution records. Let's look at processing records. Let's to see if there's a common source here, if there's a problem with the system. But unfortunately, life is not like an episode of CSI. Things don't happen in an hour. It's not until September 10th, 11th that the production records and distribution records start coming forward, and CFIA is able to look at that to see if there's some issues here. So by the time, I guess, we get to September 12th, they've identified that there's actually 3 production days that need further investigation. There's certainly the October 24th, 28th, and they want to see some more information on September 5th. So those are the things that were happening. September 12th, September 13th, because we've had positive shipments at the border, USDA automatically steps up their surveillance. They're going into more of an intensified sampling program, probably about 15 times more sampling than the normal state. So they actually found 2 more positive shipments. So that's kind of a strong signal saying there's something happening. You know, it's once it's four shipments now. So by the time we get to the 13th, I think that's probably the first defining moment in this outbreak or recall, I should say. It's still a recall. CFIA removes XL Foods from the export list, so now they can't ship product across the border. The samples and isolates that were picked up earlier in the week, well, they've been sent to the National Microbial Lab for P.Ag testing, and that's really to try to get the genetic fingerprint. So that information is now available, and it's uploaded into Canada's PulseNet, and that way allows public health agencies to see, are there any genetic matches to this? So on the 13th, obviously, if there's any cases of illness, and it's confirmed illness, the health agencies will conduct their outbreak and illness investigation. That's normal. That happens all the time. Okay, but now that we have this genetic fingerprint, they're able to say, oh, we have a match. So this is kind of a link. Unfortunately, this P.Ag is very common in ground beef, so it can't necessarily rule a connection. It's the same. Further genetic testing is undertaken. So there's another method that is used. I'll use the abbreviation MLVA, and Lorraine can talk about it more later. It's another second forensic type of testing to really further define that fingerprint. So we have suspect cases, one in Alberta, one in Saskatchewan. And because there's this interest on 3 production days, XL Food actually starts contacting their customers to say, hey, we might have a problem here. Let's start pulling that product. I'm not here to criticize CFIA in terms of how long it takes things to do, because I'm not part of that decision making. But obviously, this is when we as the public first hear about a public recall. And on September 16th, ground beef sold at Costco, Safeway, and Walmart across the country are announced that they're part of this recall. And at this point, there's still no illnesses associated with it. That's the message. So that's the first third of this investigation. Okay, sorry, I couldn't blank these out. Okay, the next step is looking past September 16th. It's obviously the first recall, and as we start looking at distribution records and things like that, more ground beef recalls are added on a daily basis, sometimes a couple times a day. There are also, as I mentioned earlier about any confirmed illnesses, public health agencies investigate. So actually, Alberta was already investigating some other illnesses, and there was 4 specific cases, not originally linked to XL beef, but because of food history, purchasing history, there was commonality to each other. So you had 4 cases that were very related, and what was the issue was that they all purchased steak from Costco, the specific Edmonton store. So that was the link. Not that it was linked to XL beef, but they all purchased it from a common source. So again, extra time takes to do the PFG testing and the MLVA testing. So that's happening. September 21st, through looking at production records and distribution records, actually 2 more production dates are identified. So now the health hazard alerts are further expanded to include a total of 5 production days. So in that period, 8 more health hazard alerts are issued. On the 21st, we see, before I jump, it was interesting to point out, we were talking about ground beef, but here we actually had some beef jerky products. And I guess, my opinion on that is, even though it's a beef jerky, if that process in making beef jerky wasn't, clearly enough to kill the E. coli, it's still at risk. So those types of products could be included in the recall. So that was kind of different. It's kind of stood out. On the 21st, the MLVA test results for those 2 cases on the 13th were different. So it actually, the link that we thought there could be, turned out not to be related to XL Foods. And that's comparing it to the isolates that were recovered. At the plant. Days later, the tenderization. So whole cuts of meat are thought, if there were contamination, it would be on the exterior of it. But if you were to grill the steak, you would kill the E. coli on the surface, and the tender would pretty much almost be sterile or free of pathogens. But with needling, you're penetrating that piece of protein. And if there's any E. coli on the outside, you're pushing it into the interior. And how do you guys have your steaks? Well done, burnt? Unlikely. So all of a sudden, our convention about grilling steaks and having it medium rare, well, we have a little gap here in terms of food safety. So the data is very compelling. Alberta Public Health Agencies, the Public Health Agency of Canada informed CFIA. We have strong epidemiological link that whole steaks or whole cuts of meat can be implicated. And so September. Okay, so again, we're focusing past the 27th. So now that we have confirmed illness associated with XL Foods, it sets this chain in motion. The Public Health Agency has activated the FIORP, which is the National Foodborne Illness Outbreak Response Protocol. There's an Outbreak Investigation Coordinating Committee, and they're responsible for liaising with CFIA, understanding what's happening at the plant, looking at illnesses that are being investigated throughout the country. It's also the day that the license at XL Foods is suspended by CFIA, so they're no longer in production. And from that point onward, the types of products included in recalls have expanded into whole cuts of beef, beef that's sent to distributors who then sell to smaller butchers who then distribute to other places. So you can sort of see that this is spiraling out. The number of products being included is just growing enormously. And so from September 28th onward, there's another 8 recall notices issued. And Lorraine mentioned about request for provincial assistance. It's rare, but unfortunately we've had 3 recalls this year where the province has been asked for assistance. And in this particular recall, that request came 3 times. We had about 80-something accounts where EHOs had to actually go out and double check that the institution had heard about the recall, that they removed product, or let us know they didn't have any product, or it was already consumed before the recall came out. And we did come across one case in Fraser where the person still had it and was still serving it. I received the notice, but they weren't doing the right thing. So thank goodness the EHO got there and that product was discarded at that moment. Okay, so certainly we can conclude that this is the largest beef recall in Canada, but is it the most serious? 21 health hazard alerts, distribution, international. There was an investigative journalist, Sherry Monk, put some numbers in, and so I'm going to use hers, they're not my numbers. The core recall included about 7 million kgs of beef products. And if we include products that had this as an ingredient, we're up to about 20 million kgs. 91 chain stores like Safeway, Walmart, Costco, and that doesn't even include all the distributors, whether it's the primary, secondary, tertiary distributors. And this isn't just ground beef, it's actually all ground beef products. Well, coffee is never boring in our office. We kind of thought, well, how much product is this? How can we come up with the interesting statistics? Oh, well, is there enough cows that were affected that would get to the moon? Well, we did the calculation. Okay, we took maybe a smaller figure of 4,500 cattle a day at the plant, 5 days. That's 22,500 cows. Average length from nose to tail is 6.5 feet, so we get 128,000 feet. Wow, if we lined them and tried to go to the moon, we wouldn't get there. But it works out to be, I think, about 40 kilometers. So if Felix Baumgartner were to climb the cow and do the space jump, he would break another record. So that's kind of how much product we're. Okay, get serious now. Let's look at this on a metric. And again, this is from Sherry Monk's blog. Well, let's look at illness versus millions of pounds of product affected. So XL Foods being on the top, 45 million pounds, that's using the 20 million kgs. It only works out to 0.33 illnesses per million pounds of product. I'm not trying to belittle the recall. It's a big financial hit. It's very disruptive from a public health illness point of view. It's not the biggest. Hudson Food in Arkansas, higher ratio, 25 million pounds, 17 illnesses. Tops Meat in New Jersey a couple years ago, 1.3 million, or 1.34 illnesses. New Food Classic, this was a recall earlier this year. 13 illnesses and 2.7 million pounds. So you can sort of see there's been other recalls. And even if we use a conservative figure like 16 million pounds, which is just the ground beef component, 13 illnesses, that ratio is 0.94, probably the second lowest so far with major ground beef. So I just kind of want to make a point that it's big from a distribution point of view, but from human illness, this isn't as bad as it sounds. And if we were to compare it to something that's still dear to our hearts, the maple leaf with the luncheon meat. And this product is ready to eat, so there is no kill step. So what you're eating could be infected. Whereas we're dealing with raw products here, where hopefully with proper cooking, we're going to address that. So you can certainly see there was more illnesses pertaining to maple leaf, and 22, I think the actual number is 23. So really, in terms of public health severity, this isn't it. So I'll turn you over to Maria to kind of talk more about the plant environment and discuss sort of issues at that plant.
Is that working? Laser. Laser. How does this work? Okay, hopefully that works. Okay, so I'm going to walk you through the slaughter process, and I hope nobody minds, but we're going to watch some videos, and I tried to make them not too graphic. So the slaughter process in where CFIA stands in these big plants, which this is a high light speed plant, We didn't have any of these in B.C., so I've never actually worked in high line speed beef. I've done high line speed hog, but not beef. But the process is still the process. So the government, the CFIA inspector, is there at antemortem screening. So they check the animals when they're live before they come through, and that is to check for noticeable diseases, injuries, illnesses. E. coli isn't something you're ever going to see as an illness, and all the animals, when they come in, they all have contamination on them. It's the nature of how they come in. So through the process, they're inspected, and then they go through the stunning and sticking and bleeding, hide removal, head removal. The inspector again checks the heads. They check the lymph nodes in the heads to make sure that they're free from disease. Check the whole appearance of the head, and then it gets eviscerated. The inspector again checks the viscera as well as all the organs inside and any lymph nodes inside. It goes through the rest of the process of being split, trimmed, and then the inspector again is supposed to be checking the carcass to make sure everything's trimmed off. Usually it's just contamination, but there could be any kind of lesions on there as well that are trimmed or set aside for veterinarian diagnosis on it. And then it goes through a carcass pasteurization and final wash. The carcass pasteurization is what is supposed to be the E. coli reduction. So if you missed any contamination during the trimming process, the pasteurization chamber, which is like a big box, is supposed to rinse the carcass first, and then it gives it a good blast of steam or hot water, vacuuming, whatever their process is at their plant. It's an approved method by CFIA for E. coli reduction. So, and then it goes on to the chilling process. So, I'm going to try and figure out how this works. Okay, I got there. Got it? Yep. Okay, we've turned the sound off because this actually played music. This is from New Zealand because I don't have any. So you can see the line is on a mechanical thing and it's going around. This is the viscera. So this is the table, and it matches up with the carcasses. So you actually know what carcass it came out of as it's going through the process. So it's going around, and then you have the final inspection here. He's just weighing them off here, and they're doing the trimming. This line speed is about 100 beef an hour. So XL is doing 3 times this. Okay? So it's going quite fast. So you can see the potential for things to go wrong. So he's just weighing them. They're doing the trimming and the cleaning. It's going around. I'm going to skip forward through this because this is really boring. There we go. So now before it goes in the cooler, this process, I don't know if it is done in Canada. This is in New Zealand. They're actually breaking through and doing partial cuts, so it's easier once it gets to the boning room and it chills quicker. So they're doing some cuts through the ribs where you'd have your brisket and your chucks in there. Now this isn't working again. And he's just great. That's where they decide the front and back half. It's split at about the, I think it's the 11th rib they're splitting it at. So you have your chuck, and then you have your rib, and it's split, and then you have your hind quarter. And then it's in the cooler where it's supposed to set and chill till the carcass is at least 4 degrees internal, 4 degrees Celsius. So depending on the kind of equipment they have, 12 to 24 hours, and then it goes for breaking. So that's how long they last in the plant, or in the cooler. How do I close this off? Technically challenged. There we go. So, what could have also gone wrong in this thing? HACCP programs weren't necessarily followed or followed correctly on the slaughter floor, like I said, the E. coli reduction process. If there was something wrong in the reduction process, the sampling is done in the processing room. Unfortunately, if it wasn't killed on the kill floor, once you get it in your processing room, it's kind of hard to find it for the amount of carcasses that they did and the size of sampling. Their sampling is called an N60 sample, which they take for this. They decide how big a lot is, however many carcasses they deem to be in a lot. And they take 60 small slices of meat throughout various parts of this lot, put it in a bag, weighing less than 2 kilos do their examination on it and make sure they don't meet the criteria for having to have a recall or for it to go for a cooked product. If they do find E. coli in it, they have the opportunity to send it off to be fully cooked and treated and disposed of, or throw it out. That's their thing to do. But when you have a line speed going at 300 plus an hour, you have 12 seconds for every carcass. So, and it could be that you have 3 people trimming, so it could be that they maybe have 45 seconds or 36 seconds to check each carcass to do their job. So your E. coli reduction and your technique and your slaughter process is very important. If you don't have a good technique, good training, good controls, contamination gets in the food. So in the fabricating part of it, or the processing, the cut and wrap end of it, once it's chilled, it's graded. The beef is graded. So A, B, or double A, single A, double A, and triple A. They do the cutting and boning, and that's where the inspectors again have their process for. Is this working again? No. So right there, the inspectors are part of the cut and wrap, making sure that they're doing their processing there. And then it's packaged in, anyone been into Costco, you see the big vacuum bags full of meat of the cuts. So they send them that way in the primal cuts as well. They don't generally send up front quarters and hind quarters to the stores. The stores want the smaller, it's easier for them to deal with. So they're boxed and sent out to either storages and into their storages, loaded and then off for shipping, and they can be in your stores within 48 hours from kill. Sometimes longer, but within 48 hours it can be from being in the barn to being on your plate. It can be that quick. So, so on their, they have their HACCP system that CFIA does basically from slaughter to the end. What's the other one? There's another one there. Oh, no, it was the other one. Go back. Was it? No, that was the other one. Sorry. Yeah, just hit play. So now this is a high line speed breaking. So you can see what he's doing. Now the steaks that those people ate was that. That's a strip loin. Now do you see the table? They're not sanitizing it in between. They're not sanitizing their knives. They're wearing cloth gloves. Everything that holds bacteria. If there is bacteria in the meat, you see how easy it can spread? So if it was on one of those carcasses that someone handled and it kept getting pushed, those tables are not clean till the end of the day. There's not supposed to be E. coli in this room, so there's no requirement to do it. And this is how fast the speed goes. This one is probably how fast the line speed goes at Cargill. This is about 300 an hour. So this is how fast they're working preparing your meat. If it's not clean, they're just spreading it, because not one of those people is sanitizing a knife or changing their gloves in between in their cloth gloves. So it just absorbs and spreads. Okay, so what went wrong? Obviously contamination got on the carcasses. This is the part of the process which is known as rumping and bunging. So bunging is where they tie off the bung, the sphincter, and we all know what comes out of that. And it is tied off, I'm going to stand over here so you can see, in this area right here. So when they do that and they're pulling back the hide, a lot of times when the animals travel, they end up with very loose stool that gets spread around with their tail, and all gets in this area. So best attention's even trying to keep it clean, you will find a lot of contamination in the rump area. And when they tie off the bung, and now it's there. So you can see as they go through the steps, and the hide, it's from there and it's coming this way on this carcass, so they're pulling it down one at a time. You have to be very careful. You don't want the leg from this animal touching the exposed flesh on that one, because that's got contamination on. Spacing is important, so you want to make sure things are kept apart. Once it gets to the area where they have the hide puller, they basically just attach this machine and it pulls the hide down, so it's on this part of it. So if you have contamination on there and you're pulling it down, you're pulling it down the back of the animal. Generally, trim is on the front, the opening part. That's what they use for the hamburger. The back end is a nice primal cut. That's where you have your T-bone steaks and your rib steaks and all that along the back. If there's contamination on there and it's not trimmed off, and they wash the carcass and it washes it down the back, and then the E. coli reduction doesn't work in your pasteurization tunnel, you now have contamination on the outside of that. Generally, whole muscle products, you're going to cook them. That unfortunately didn't happen. So what did go wrong, what CFI did admit during their on-site inspection, is there was some nozzles that were plugged. So that meant that the cleaning process and the pasteurization and the E. coli reduction wasn't effective. It missed. How much? Doesn't matter. Because as soon as it's on there, you saw how quick that line went in the cutting room, it spread. The idea is to make sure it never leaves the kill floor. The slaughter floor is where it needs to be controlled. Once it leaves the kill floor, trying to get it out of that plant will be hard. So sanitation, yes, is important. So if it would have been just 1 day's kill that was a problem, you have cleanup to cleanup, it's that 1 day's kill. But it was more days added. So it was on the kill floor, and it was in the cutting room. And that's where it spread. CFI's monitoring also wasn't followed. What could have been done better is the on-site pre-operational inspection to make sure that all your equipment is working properly, not that just it's cleaned. If the nozzle was plugged, what was it plugged with? It was plugged. So was it plugged with fat? Was it plugged with the bacteria? What was it plugged with? Yeah, it was plugged. It's to make sure your equipment's working properly before you start checking and making sure everything's right. So there was a few things that some people weren't checking on, whether it was the plant's responsibility, whether it was CFI's responsibility. It wasn't done. So, and I don't think the people who got sick really care whose job it was. It just wasn't done. So what went wrong? Federal Food Agency actually admitted failure, and it was by both parts. So now, Lorraine, it's your turn.
Thanks. Okay, so I'm going to go back a little bit and talk about identifying cases and talk about public health aspects. This statistic, I've been told it's actually being worked on to be updated, but in fact, based on all of the references and studies down below there, we think that we at least have 1 million cases of foodborne acute gastroenteritis or gastrointestinal illnesses in BC annually, and it costs us about 100 million. Maria sent me some interesting stats for Canada that came out recently that focused just on E. coli O157, and in fact, across Canada, based on primary and secondary long-term illness, we think the cost estimates for that are 244 million a year. So there was some modeling done in an Ontario project, and these are long-term illness costs. So this is, for instance, when you have VTEC and hemolytic uremic syndrome and all those kinds of long-term chronic sequelae. Anyways, most of the illnesses, 47%, do occur in children and adolescents. So that's one of the reasons that we really don't want to have these kinds of O157 illnesses in children. So, how many reported cases can we say relate to community cases? Have any of you learned this in school? Because I'll just go through it really quick, but if you haven't had this kind of thing yet, I'll take more time. Does anyone know the number? So if we have one reported case of gastroenteritis illness, how many actually occurred in the community? Yeah, that's pretty close. But since she's your instructor, I better go through this a bit. Okay, so what happens? Somebody gets ill. And then sometimes they go to the doctor, but not everybody goes to the doctor. Just some people go to the doctor. And then they're requested probably by their physician to submit a poo sample. Now, I used to work in the lab. I can tell you most people don't want to submit a poo sample. In fact, I had supervisors that got sick, and I gave them a kit, and they didn't submit a poo sample. They submit the sample, some of them, And then the lab test for the pathogen. Of course, you have the sensitivity, specificity. Did the right test get requested? I mean, it depends on their presentation, right? There's some studies that show that if someone goes to the doctor and they're vomiting, they're less likely to request a stool sample, even though a lot of diarrheal illnesses do also present with vomiting. Is the case confirmed? So even though there is a specimen submitted and tested, there's quite a few times where you're not going to actually get a positive. The bacteria or the parasites or even the viruses that are in stool can sometimes be shed sporadically, or maybe they're too far along in the illness and you won't see them there anymore. And then of those lab-confirmed cases, most of them do get reported by the local laboratories or hospitals to the provincial public health institution. And most of those, or probably all of those, do get reported to surveillance nationally, but not all of them. So there's a loss each time. So what happened in the previous slide, you have the number of people actually reported to surveillance, and you compare that to the number of people that become ill. What questions do you need to ask to learn this information? I don't want to spend lots of time on this, but in fact there was a series of 3 or 4 surveys that were done across Canada to answer all of these questions, and they were on the references on the previous slide. So if you're really interested, you can go and get the papers and read about it in detail. This particular slide that I'm showing you here and the next one was from Laura McDougall, and she works at B.C. Centre for Disease Control. When I first met her, she was with epidemiology, but now she's with bioinformatics. So they did all these break. There isn't very many cases reported in BC. There's only 3 so far, and one was a visitor. Maybe there's a lot more that went unreported. So that's all I want to say about that. This slide I'm allowed to show you today, but it won't be archived. So when this recall was happening, a lot of us in public health get these weekly reports from the National Enteric Surveillance Program. So when I talked about all the reporting that's done, it's through a provincial laboratory network, and then it all funnels into the National Microlab, and they compile statistics across the country. So this came out, and I thought this fits this presentation we're doing today perfectly, because in fact, we have all these illnesses, but it hasn't even created a spike. We're below right now what we normally get for E.coli O157. So how is it that we even caught this outbreak? So 15 illnesses across Canada, you know, it's not that big of a deal. And another thing that they reported at PulseNet was that, again, as Sai said, this pattern combination is the most common for E. coli. So that's why they started using MLVA to determine relatedness to the actual beef. So what are these techniques? I don't know if you guys have been taught this kind of stuff yet either. Any lab geeks here? I used to be one. Oh, okay. Well, one person, I'll go through it for sure. Okay, so the one that's in the National Microlab now that's been used for years and years, and it's slowly being replaced by more modern methods, but this is pulse field gel electrophoresis. So in terms of the E. coli bacteria, or O157, or whatever E. coli bacteria it is, they're looking at the whole genome of the bacteria. So basically, you grow all the bacteria on an agar plate, you stick it in an agarose block, and then you do a restriction enzyme analysis. So different types of restriction enzymes will cut the chromosomal DNA at specific spots. And once that happens, you just run it on a gel. And you run it on a special pulse field gel. Because these are very large fragments, you have a hexagonal array where you run the pieces in different pulses. And then you look at the fingerprint. So how they're determining now the relatedness to the beef recall is they're using something new called multiple locus variable number tandem repeat analysis. So again, they're looking at the genome, but only a part of it, parts of the loci, and they're actually looking at repeating DNA fragments on there, and these patterns can be very specific. So related isolates might have 5 of these repeating DNA patterns, and other ones might have 7 or 10 or 12. So I don't know if you guys know what polymerase chain reaction is, but again, you have specific molecular primer probes that look for these repeating fragments. And then this is a an automatic sequencer, and you get all these spikes, and the different colored spikes tell you if they're related in terms of how many DNA repeats. This method is for E.coli O157. I checked the National Micro Lab. It's not actually in their manual of services yet, but they do have it for other bugs. So it might be something they're considering, or it might be just a technique that they're using in the interim until they develop a better one. But that's what MLVA is. So we've talked about the 15 illnesses across Canada. Right now, the case definition for this particular outbreak is to have a match with both enzymes on the PFGE. That's the restriction enzymes I'm talking about, and a match using MLVA. So just to get towards the end of the presentation here, these case identification challenges that we have for this outbreak, I showed you that E. coli hasn't increased in BC or nationally. The pattern is common. MLVA was able to rule in and rule out cases. And I think we can probably say that the match to these cases only occurred because of the massive scope of this recall. Otherwise, it really wouldn't have been on anyone's radar. There were a cluster of cases linked to the beef, and those would always get followed up, but only PFGE is normally done on those, and they wouldn't do the extra step to do the MLVA. So I think this was fortuitous, if you want to talk about it in that way, is that we had a regulatory process coincide with a cluster of illnesses that closed this loop. And the other thing that I just wanted to point out is that more and more when the EPIs are doing these tracebacks and the EHOs are doing these tracebacks, we do have agreements with different stores so that we can actually look at the customer receipts to see what people have bought, and that helps us a lot, so with the traceback. So issues and risk communications. I think Maria and I are both going to come up. We wanted to talk a little bit about things that are needed at slaughter and things that are needed at retail. And needling and aging is a big issue now. So we'll just hand it around. We'll just hand the mic around. If I can get it off. Or you can just talk on your talk to my booth.
Oh, it fell off.
Oh, yeah,
here. So due diligence on the part of the operators as well as government and the employees, making sure that if you're going to use new technology to process to make things faster, to push the meat out quicker, you have to make sure that the training and the people that are used there to use the technology are well trained and that the two coincide. You can't just have machines there to push beef through without having the people capable to keep up. So the two have to go together, and it's a responsibility of both the owners of the facilities and the government that is monitoring it to make sure our meat is safe. So.
Okay, in terms of needling, it's not something new. More questions we ask, the more we find out, oh, this process has been in place by industry for a long time. If you're buying properly aged beef, 21, 14, 21, 28, there's probably no need to do the mechanical tenderization. But if we're getting beef from the barn to your store in 2 days, that meat hasn't properly aged yet. It's going to be a little tougher, and that's where needling comes in place. So again, it's raised a lot of questions. How do we know that we're buying tenderized beef? How do we know that we have a higher risk due to contamination of the beef? So a lot of questions are happening at the national level, and hopefully next week we'll get some help and guidance from the national bodies.
That brings us to the last slide. I thought this was pretty funny when I saw it in the paper last week. I just wanted to, again, to acknowledge all of the EHOs that helped with the recall effectiveness checks. I had a look at our line listing. So within the last 2 weeks, in at least 4 of the 5 health authorities, there were 88 visits done by EHOs to make sure that these high-risk products aren't being consumed or sold. And last August it was mangoes, so let's hope there's no more for a while. And if you have any questions, we're happy to answer them.